How do I know if my child needs OT? And I won't reiterate our introductions that Joe so nicely went over, but we just wanted to welcome you all and let you know that we will have time at the end for questions. So as thoughts come up during our presentation, we'd love to hear your questions at the end.
And just one other thing, we will turn off the recording before the question and answer section in case anything sensitive is discussed that won't be recorded.
Okay, wonderful. Thank you. Okay, so to start us off, what is OT? We find that we answer that question an awful lot, and there's definitely some misconceptions. People tend to think that we help people get jobs, which can be a very minor or lesser known element of the position. But occupational therapy, which we call OT for short, is a healthcare profession that helps infants, children, and adults to either acquire or regain the skills needed to perform the activities, or what we call occupations, of daily life in your home, school, or work environment. So it's called occupational therapy because it has to do with those activities that we do every day. So what do we do? Occupational therapy is a graduate level profession, and the coursework involves studying anatomy, physiology, neurology, kinesiology, human development, psychology, sensory processing, and the therapeutic use of activity. And OTs work with people throughout their lifespan, as I mentioned, infant all the way through adulthood. And we work in various settings: early intervention, preschool programs, schools, clinics, hospitals, rehab centers, in mental health centers, as well as geriatric programs. And OT, our aim is to help people to live their lives as independently as possible.
Okay, so I'm Megan, and I'm going to share and talk about the next few slides. So who are pediatric OTs? Pediatric OTs specialize in working with children, newborns through 18 years of age. We can work with kids even in a NICU unit up to when kids are graduating from high school. OTs work with children with a variety of diagnoses. Some of these include autism spectrum disorders, Down syndrome, cerebral palsy, attention deficit disorder, sensory processing disorder, specific learning disabilities, and that's just naming a few. So when a child has difficulties or delays in mastering the developmental tasks, or if they display unusual sensory responses, or if they demonstrate consistently dysregulated behavior, then an OT is often contacted to assess, evaluate the child. So OTs use a whole child approach, and we work closely with families, caretakers, and other health professionals and educational professionals to provide comprehensive intervention. So I know as parents, we all watch our children and like to observe what they're doing. So it's likely you're going to identify strengths and challenges when you observe your children engaging in various developmental tasks. And it's important you take note of these. If you notice any difficulties, it's really important to take note of those so that you can share this information with your child's physician, any other medical and educational providers, teachers. And some of the common developmental areas that may indicate a need for OT are as follows. So the first area is gross motor, and those are your big muscles. And some things you might be aware of when watching your child is your child tires easily. You find that when they're playing, they just wear out sooner than other children. Or you may notice they have low muscle tone or floppy muscles. Sometimes you can also see high muscle tones and tight muscles. They may have difficulty with balance and fall easily or just kind of trip over things. Poor coordination, a hard time imitating movement. So maybe if somebody is showing them movement or activity, or you are as a parent, it's hard for them to follow along. Your child may have difficulty with crawling, rolling, jumping, standing on tiptoe, or running. Also, you might see challenges with rolling, throwing, catching, or kicking a ball. And another area you might see challenges with is your child might be unable to pedal a riding toy or a tricycle. And they may have difficulty managing themselves outside on the playground and on playground equipment. Okay, and then the next area we'll discuss is fine motor. That's using your arms and hands and fingers for activities. So some things you may notice again is weakness, but this time you would see it focused on the arms, hands, or fingers. You may see difficulty with grasping objects or releasing them. Or you may notice your child frequently drops objects. They may not use their index pointer finger to point at things or pick or push or pick up little things. They may also have a hard time using their we call these the pincer fingers, have a hard time using those to pick up tiny objects. They may have difficulty using, they may not transfer toys from hand to hand, like when you want them to bring it to center and hand it over. Your child may have difficulty using both hands together to clap or play, or they may have difficulty turning the pages. They may just pick up a number of pages at a time and have a hard time picking them up, turning them singly. Your child may struggle with lacing beads, building with blocks, or separating pop beads. And you may notice they hold a crayon or a marker or pencil with a whole hand grasp and fisted, and sometimes it can be upside down too. And also, they may be unable to grasp and operate safety scissors. And we often see kids that hold scissors upside down too, or sometimes use both hands together.
Great. Okay. So the next area of skill deficit that you might encounter is what we call visual motor. So that's using our eyes to do things like identify shapes or colors. When they're doing tasks such as sorting by shape, size, or color, you need to be able to use your visual skills along with your motor skills to accomplish that task. A child with visual motor challenges might have difficulty placing shapes in a shape board or doing a simple puzzle. Sometimes it can show up in difficulty doing blocks, such as creating a tower, or a train, or a bridge from a model. So if there's another tower and they're asked to create a duplicate or copy it, that might be challenging versus just creating something that they imagine on their own. There can be challenges with organizing or stacking nesting cups. Those are cups where we have one size and then the next size smaller, and they fit inside each other. And usually there's like 6 or 7 that they can play with. Excuse me. They may scribble randomly versus actually creating a line or a shape that someone has asked them to do, or if they have a workbook or a coloring page that has a shape, instead of actually doing what's on the page, they may just scribble because they're unable to take in that visual information. And then also difficulty imitating pre-writing strokes. The strokes that we really want every child to have a strong understanding of is vertical and horizontal, as well as circular strokes, because all of those strokes are what we need to be able to write letters. So it's sort of like the building block to, handwriting and writing letters. The next area is self-care. So if your child is having trouble with what we call activities of daily living, as I mentioned in our introduction, and really with like the very basic skills to take care of themselves, hygiene-wise and dressing. So things like toileting, undressing and dressing, all the different parts of their outfit, having trouble taking off or putting on their socks and shoes, needing help with basic hygiene, like even washing and drying hands independently, difficulty with feeding themselves, whether, depending on what age they are, looking at those milestones of, if they're a baby and maybe the age that they are, a typically developing child would be self-feeding, little pieces of cereal or small pieces of fruits or vegetables. And if they're not doing that and they seem to be behind their peers, then that's when we would be considering, is there a challenge here? Another thing that might come up is that they spill food a lot. They're just kind of having trouble managing food and, the plates, cups, all of those things that we use to serve our food and get it to our mouth without making too much of a mess, outside of normal kid messes, of course. And then challenges with using utensils, particularly if there's a fine motor challenge, and also the visual motor challenge can make it difficult to get the food from the plate or bowl to the mouth. And then also needing support for drinking. Is there something going on with their oral motor system that's making it difficult for them to manage the act of actually drinking a liquid? The next one is play. We love to use play as how we accomplish our therapy and how we bond and create rapport with our students and clients. So we would be looking at if the child is having trouble engaging in age level play. Have they moved on to parallel or later interactive play with other children, or are they preferring to play completely by themselves? Or on the flip side of things, are they unable to play independently? Do they need to rely on someone else to guide them? And related to that, is there a lack of ability to engage in imagination in their play? Is it very sort of routine-based versus creating, something sort of fantastical with a typical object? And then there's playing repetitively. So, lining up the same type of toy or organizing, but not actually playing with them, or refusing to play with anything else and being very rigid about playing with those same toys every single day. And then there's avoiding playing with others due to sensory sensitivities. And I'm going to go into sensory in the next slide, but what that might look like is if they're having a hard time because the noise level in the room is too much for them, then they might shut down and they might not be engaging with their peers because they're having to have a reaction and manage the sensory information that they're struggling with. So that brings us on to sensory. Sensory processing, or sensory integration, as some people call it, is how our nervous system takes in sensory input. So things like light, sound, the information that our muscles need to have to know where our body is in space, being able to swing and jump and move around. That's all sensory input information that our nervous system processes for us. So what that can look like if there's some delays or challenges is there might be a child having a strong reaction to loud noises or bright lights. You may see them constantly touching or fidgeting with objects. oh, I guess that's a little bit repetitive, often fidgets with items. Sometimes they might be mouthing objects. Maybe they're seeking some input in their mouth or oral motor. So they might be putting non-food items into their mouth, which obviously is a safety hazard. Some children with sensory processing challenges will avoid messy textures. And we're talking about, typically more extreme. I think we all have some sensitivities in these areas, but really an OT can help you figure out if it's beyond just sort of like, oh, they just don't really like sand, but is it they just, have a total meltdown, or are they avoiding multiple textures, Play-Doh, finger paint, glue, having their hands wet at all, things like that. An OT can help you figure out kind of what's within the realm of typical versus maybe something needs to be addressed. Also, some children will avoid being cuddled or touched at all. So obviously that would be very alarming and sad as a parent. Sometimes it shows itself in that they dislike baths or teeth brushing, having their hair washed or their hair cut. It can be very upsetting. Sometimes it can be sensitivity to clothing textures or the tags on the clothes. And it's really hard if a child is nonverbal and they can't tell you that. So sometimes we really have to play detective and see if we can figure out what's upsetting them and then try to make those changes. It can also include sensitivity to food textures. So you might find that your child is avoiding certain foods. And if you kind of start to notice a pattern, maybe it's only foods that are crunchy or only foods that are really soft and mushy, there might be a challenge there. Also avoiding playground equipment. As I mentioned, our nervous system takes in information about where I am in space, and children who have sensory processing challenges might avoid swinging or going down slides or even using stairs because it feels unstable to them and it's just too much. It's not comfortable. Also, they might dislike raised surfaces. So going up on a stage for a class play or performance, sometimes playgrounds have varying levels that kids can play on, and you might notice that they just will not go to a higher surface. And then lastly is being overly active and then having a hard time slowing down. They might seem like a Tasmanian devil, and there's just like, it's really hard to transition into a more calm activity. And that can be a challenge when their sensory system doesn't know how to make that transition.
Okay, thanks, Susie. And I'm going to talk about self-regulation now. And self-regulation is the ability to understand and manage your behavior and your reactions and feelings to things that are happening around you and in your life. So some of the things we may see with children is difficulty with handling unexpected changes in routine or schedule. They like things a certain way, and when something doesn't happen the way they were predicting, it can be really challenging for them. It may also be difficult transitioning from one activity to another, particularly if it's an activity they're enjoying. It may be very hard to move on to another activity. And again, like Susie said, we would be looking for reactions that are, more increased than what we would expect. And also strong reactions to disappointing or frustrating situations, maybe becoming very upset or crying or having a meltdown. The child may have difficulty focusing and often moves from activity to activity, and it's hard to get them to complete any activity because they're so busy looking at the next activity and moving on to that. You may also see an excessive need to control things. And that often happens because the world can feel quite uncontrollable to children that have self-regulation needs. They may have frequent, unpredictable meltdowns and then have a hard time calming themselves afterwards.
Are you able to see that one, Megan?
Yeah, let me just, okay. If you have any concerns regarding your child's development, and these are things you've noticed or things we've talked about here, as we mentioned, be aware of them, maybe make a list of things you're aware of and concerned about, and then share these with your child's pediatrician, their various health professionals, providers, and their teachers. Okay, so now both Susie and I are going to answer questions. So this is an opportunity to share any questions you may have about OT or about the different areas we described, or about things you're noticing in your own children that you would like to talk about or ask questions about.